The hospital pay. But in case the hospital doesn't pay, Ashacare will pay for you. We have to verify the hospital first. We verify both sides. So the simplest level, which is level 2, they pay 2,500. For level 6, they pay 20,000 per month. It's a subscription.
Tell us who is Masi Wangeshi.
Masi Wangeshi is a medical professional. I did my degree and I joined campus and I did my degree in medicine, and then from there I went to my internship in Embu County, whereby in Embu County as an intern you are trained by fire by force, whereby you see emergencies, you have to handle them. Sometimes you're overworked and understaffed. So it's when I joined with Ombogo to do health shifts, but it was just an idea on how to make sure that people are recognized by what they do. And also the hospitals get the value for the HR, that is the money they are paying, and also for the patient to get quality services. So that's when we decided to do health shifts by Ashacare Medical Solutions. The company is called Ashacare Medical Solutions. When we came together, we joined to form Ashacare. Ashacare means that it's tender care for the healthcare industry, and we build sustainable, smarter solutions. But Health Shift was formed then. The idea came in then. We had to sit down and try to do it as simple as possible because we didn't want to replicate or make it difficult for healthcare professionals to find part-time jobs.
And first of all, I want you to tell me a bit of your history. You said you started in 2013.
Yes, as a medical professional.
As a medical practitioner.
Yeah.
Did you ever thought that in your wildest dreams that one day I would actually go into business or the business of medicine? Because we understand that there is medicine, business of medicine, there is media, business of media, and every other sector we can think about. Did you have that dream when you joined?
No, when I joined the medical field, I joined to become a medical professional. I'm a practitioner, whereby my dream was to treat people, to give quality services to people. I didn't think about business at any given moment. But now, there is what you're taught in school, but then there is a reality, whereby you find that when you're overworked, you have burnout. How are you going to attend to clients? It's either you give poor, or you tend to few, and then you leave the rest. Because most of the patients tend to come to public hospitals. So I didn't have any idea that I would become a business person at any given moment.
So when did this idea now begin to solidify?
Decided to bridge the gap, because actually it's the pain points that takes you there. When you see there is pain in the industry, when you see patients complain every time, when you see like the industry is not giving quality. You know, when a patient comes to you as a hospital, or to you as a medical practitioner, they expect to get quality treatment. Wamekuja kupona. So what do? It's either you give quality or you don't treat at all. Then you lose clientele. So instead of that woman, that patient who came to the hospital to just get frustrated, you have to make sure that you're giving the best.
So did you ever experience this thing in person, like whereby you were burnt out and you couldn't go to the hospital, yet you still understood and know very well that in the hospital there are people who are sick and they want to be assisted and they want the best care possible. And therefore then came this idea.
When you're an intern, you're the first on call. Then there's second on call, who is the resident, and then there's third on call, who is now the surgeon or the the physician, the consultant, now they are third on call. So when a case is too hard for you, you call second on call. Now when second on call comes, you do it. But if it is beyond the first and the second, you call the third on call. So it happened, I was on call and there was an incident somewhere along Embu. And we had a lot of patients in there. Casualty. These patients were streaming from casualty, others to the ward, others to the theatre. So you find that we are not enough. You have called your first, your second, all the interns are there, even from other departments coming to help you, but we are still not yet enough. So you are doing the priority list. But as you do the priority list, attending to the most critical, this other one, because of the delay, they are also complicating to that critical. You hear me? So with that, we had to find a way on how to ensure that we are not delaying any treatment at any given moment, because delay in treatment will result to complication. Complication will result to you being maybe admitted to ICU, or if you are an outpatient, you are just to be treated and you go home, you'll be admitted to the ward. That is also more patient will end up spending more cash at the end of the day. So what do? It's either you go to the industry and make it better as a medical practitioner or professional, any profession you are in. And mostly, remember, where you do your internship, that is only where your skills are recognized. In other places, you're not recognized. Then you end to do, like, if you're doing an internship here, for example, you're doing internship in Embu, my skills will be recognized in Embu. Once I finish my internship, I have to go and prove my skills somewhere else. So if I don't find a full hospital, a fully fledged hospital, like for example, another level 5, like the one I was interning to, and maybe find a level 2 or a level 3, I'll tend downscaling my skills. Why? Because I'm not utilizing all the skills I've gained. So that is what I'm talking about, recognition. Then another thing, in hospital, if there are no systems in place, you hear that if a case happens in public hospital, there's no need to pursue it. Why? Because those people are overworked, right? Or if it happens in a big facility, it will be sued for malpractice if you have the energy to. So why wait for malpractice to happen? Why can't you just make a system so smooth so that we do not wait for malpractice, we do not wait for complications, right? So it will be a both win for the patient and for the hospital at the end of the day.
Yeah. Now let's get to the business side of it, because actually Ashacare Media we focus on tech and business. And now we are women in tech, and you're one of the winners. Now let's focus on the business side of Ashacare. When did you incorporate it, and how did you even get the capital, the initial capital? Did you bootstrap or you had some savings?
Trust me, business is hard. So when we joined, we came up, 2 people came up and combined the internship money. And also, okay, I can't tell you, I have this idea, I don't have enough capital, you have the skills. So you either come into with the skills or you come in with capital, right? But remember, when choosing a business partner, you have to choose a person whom you are aligned with. You cannot just go out there and choose because they have a lot of money and they don't even have a concept of what's going on, because that business again will fail. So we came 2 medics. We joined hands, then we met our CTO, Joel Wambogo, whereby he was doing health system management.
HSM.
Yes, HSM in a hospital. And then we were like, let's see how this system works. This is how the system works. And number 2, in case there is a hitch, we're going to tell you from the clinical point of view. So we tell you from here to here, this is how it works. So why can't you make it simpler? We started there. From the HMIS we had back then to what we have right now, I can tell you, major hospitals are using our HMIS. Why? Because it incorporates and it's able to integrate a lot of systems together. Even if you want health shift, if you want human resource to be integrated, if you want the biometric, if you want the attendance, when a patient comes in, then they log in their details for the queuing. It's able to integrate immediately. We have ensured that it's a continuous improvement. Right now, we are doing the SHA integration pathway, the digital superhighway. Why are we integrating it? It has already been integrated, but we are still streamlining it because the world is changing. You don't need to do paperwork when you can do a digital and have an audit trail. From this patient came in at this particular time, this was the turnaround time, this is where the delay was. So as a hospital, you have a give ahead, or you're able to know that I need to work on this department. This particular person is not improving this department. You're able to have that audit trail. So when it comes to a business, you need people to come together, not just with money, people who are aligned in what you're doing. So we joined together. We didn't bootstrap at first. We joined together what we had, and then from there we continued to learn. It's a learning process. You fall, you wake up the next day. You have to keep fighting. What, are we still practicing? Yes. You can find me in health shift. If you post a shift today and I have a free time, I'll come and I'll do the work.
Yeah, and we're getting there. So in terms of the services that you offer, maybe list some of the services that you offer and how people can actually get in touch.
Okay. We are called Ashacare Medical Solutions. So if you go to the Google Chrome, you just Google Ashacare Medical Solutions Limited. You'll find our services, all of them there. Number two, some of the networks we have created, you might hear someone telling you that we know about Ashacare. They have done 1, 2, 3 for us. So we will also appreciate if you hear about us and you tell us that we heard about you from this particular, because we are getting a lot of referrals actually from people who have interacted with the hospitals that we work closely with. Yes, so you may find us anywhere. But majorly, our offices, if you want to come to our offices, we're in Chandaria, Business Incubation and Innovation Center, Pale Kenyatta University along the Road, if you want to find our offices.
Yeah. When we started this conversation, you talked about local. Talk about that one, because I know some of the people I know are also in
the medical field.
Yeah.
Now I know it's a hassle. Locum is a part-time job.
The hassle for medical practitioner.
Yeah, for medical practitioner. So in case maybe you need, for like me, I'm a mother, by the way, and in case I don't want to work full-time, I'll tend to look for locum. Why locum? It's part-time, it's flexible, and also I'll get recognized at the end of the day because of my skills. It's what will make you call me today, tomorrow. Productivity is there when it comes to locum, because I want you to call me tomorrow, the next day, so I'll come and do everything. Yes, that is within my scope. So locum is that part-time. You tell me that you have a shift. For example, which hospital is near here? We can say, yes, we can say Aga Khan. So in case Aga Khan, they have, there's a major incident around, like maybe a bomb blast, or there's an accident that involve a lot of people and they are taken to Aga Khan. They might be prepared. They start calling the other people who are not on duty. That is the first step. When there are major cases hit the hospital, they'll first call people who are off. But you might call me and I'm off. It's my day off and I might be in Nyeri. What will you do? Will you start calling a person whom you don't know? No. So you just go to our website, Ashacare. You will find Health Shift. It's healthshift.co.ke. It's in Kenya, co.ke.
Yeah.
So you ensure that you just post a shift. Once you have posted that shift, that you need this at this particular time. Within, because it's a short distance, 25-kilometer radius, within 15 to 30 minutes, you have a replacement right there. You won't wait for me to come all the way 4 hours, or I tell you I'm not within. You'll get a person who is verified, who you're able to see their credential right there and then, and you can also interview right there and then within the web. You can also be able to see, because we rate. In case I come to a hospital and I don't do good, you're supposed to rate me. So remember, if I'm rated, you're able to know that I've worked here and here, and this is my rating. So I'm good at what I do. So you'll be more motivated even to call me, because you can see like I have experience in this particular cases or hospitals. Yeah.
Interesting. So for a doctor or a medical practitioner out there who actually is hustling, is not employed anywhere, how can they get in touch with you, and how does the payments work?
Okay, now this is the thing. The hospital pay. But in case the hospital doesn't pay, Ashacare will pay for you, the locum. And then, sisi tunabaki as we
follow up.
Yes, follow up. So it means that a hospital, we have to verify the hospital first. We verify both sides. If you're a new hospital joining us, you join us, you go to healthshift.co.ke or Ashacare, you click healthshift, then it will take you to that. You have to upload your license as a facility. We have to verify that you exist in that location you have, and that license is, and this is also the level of the facility you are. Once we have done that, then also the medical practitioner, whoever, whether a nurse, orthopedic surgeon, whether an ophthalmologist, anesthetist, medical officer, when you join us, we have also to verify you. So you're going to upload your license, your location, your CV. What do? We even call where you have worked before through here. And we don't call the resumes, the people you provide. We even go there in case we are not able to get in touch. We go there. So that tusipate, you went to a certain hospital and you defrauded a patient, or you had a misconduct. So we ensure that we verify. Now that is our work. Verification. From there, once you do once you verified, you are able to assess the shift depending on your cadre. So if you're a community oral health officer, you'll get for community health officer. If you're a medical doctor, you'll get throughout the cadre. We have around 645 medical practitioners. For the hospital, we have like 100 hospital. But what we do for the hospital, they don't pay immediately. We have one pilot month. Then you determine if you're going to go ahead with our product or not. Then if the product is good, for the second month, now you pay depending on the level. So the simplest level, which is level 2, they pay 2,500. For level 6, they pay 20,000 per month. It's a subscription.
Subscription basis.
Yes.
So in terms of the money, that the revenues that you make, which part of the business, because you talked about locum and you also have different other services, which one is doing the best out of the many services that you offer?
Okay, right now, all are incorporated. You see, I can tell you only one. Why? Because when I come to your hospital, like you call me to your hospital, we assess. Once we have assessed, what do? We tell you your HMIS or your operations have this deficits, and this is where you're losing money from a business perspective. Then from there, we done the audit, the whole audit. We have told you, so you need 1, 2, 3. If you want to choose us, we'll come and show you our work. So the most that is being bought out, it's the health shift and the hospital management system. Yeah.
And when you say health sheets, that is local.
The locum one, yeah.
Very-
I think
the most
people should know the locum, yeah.
Locum,
yes,
kind of.
for the locum, yeah.
Now let's talk about the management of the business. You know, having a business, or they say having an idea is just one part of, or one piece of the puzzle. Executing it is another. How do you run the operations, and how do you ensure that whatever you're doing, you do it to the maximum level of professionalism required?
Let me tell you.
Especially now that the medical industry is so regulated. Yeah.
Team and culture. That's all you need to do. You need to have a strong team, an aligned team, not just team which is coming for money. A team that is able to strategize with you and deliver with you. So when you go low, they go low. When you go high, they go high. Not a person who is going to leave you anytime. That is one. Number two, you have to build a culture. For us, our key areas: accountability, responsibility, and integrity. Those three is what keeps us, because we're dealing with hospitals which are tendering to patients. I might be sick, my sister might be sick. What will happen? They will walk into any facility. From a medical perspective, I might know this prescription was based on money or from the insurance they have. But for them, they don't know that. So what are we trying to introduce to the market? Accountability. Every person has to be accountable. Hospitals have to be accountable. Medical professionals, all of them, they have to be accountable. They have to be responsible for any patient who comes in. Responsibility is key. Then integrity. You cannot do anything without integrity. And it has to start with your team before it trickles down to other partners you work with.
Yeah, and because you've mentioned the team, how many people do you have in the team right now?
We have 5 major, but we also have part-time workers also. We used to do local, but now part-time from different fields.
Yeah. Now let's talk about financing or funding. Have you received funding before?
For funding, as I've told you, we have not received before. And for this one, this is a very good program. Sometimes you find incubators which are not awarding you afterwards.
And for clarity for our audience, this incubator is the Standard Chartered Women in Tech.
No, there are other incubators out there. You just need to know your industry. That is one. Once you have known your industry, you know your market. Those two, because you have to keep making sales. Whether you find an investor, when you find funding, you have to keep making sales. What you need to know first as a business, you have to make sales for you to call it a business. You have to have a good customer experience, and also user experience. Simplicity. Don't come with a platform that is bringing more troubles than already what they have.
Yeah.
So once you have done that, when it comes to customer, you have to go out there and get them. Others will find you. If you do good work, let me tell you, among the 100 hospitals that we have, we've piloted with 20 hospitals. We had to stop the pilot early. Why? Because more hospitals kept coming in. From the users, there was that testimony. I am working with this. Even we started getting more hospitals outside what you were piloting with. And we had to accommodate them. We listened to them. Change here, change here. We started with a 35 kilometers radius. 35 was not working because it was taking 45 minutes and it's an emergency. We trickled it down to 25. That 25 kilometer radius, a person is able to get to your hospitals within 5 to 30 minutes from where they are.
Interesting. And when you say that you received a lot of requests from hospital and other medical practitioners, does it mean then that with that and the structure that you have already, you're also looking for more funding now to ensure that you expand?
We're in 3 counties, but there are other counties, one peak hospital. So we're in 3 counties, Kiambu, Nairobi, and Machakos County. But we want to hit the 47 counties. So we are looking for investors. any investments that will come, whether in terms of marketing, whether in terms of partnership, it's welcome. Because we have to make sure that the whole Kenyan community is accountable, responsible, and has integrity in terms of healthcare.
Yeah. We're almost wrapping up. What is your vision for Ashacare?
Vision for Ashacare. We want first to hit the 47 counties, then we go to regional. We have to start with home. We ensure that home is good, and then we go to the 47 counties. From there, we can go regional. And we are looking by a future where hospitals won't have to stall because of malpractices. It won't have to stall because it didn't have enough, the insurance company didn't pay on time. So we are looking also to start giving advanced locum. That is, we pay all your locumers and then you pay us later.
Okay, now we are in the second last vision. Talk to me about what do you feel, or how do you feel to win an award or a grant from today's cohort of Sun Chartered Women in Tech?
I feel good, and I thank the team. I don't work alone. We work as a team. So the team, we have been strong. We have had resilience throughout, and I'm happy so far that we've been able to achieve this, because it was the accelerator was a 12-week, 10 years. Being a business person, being a mom, being a medic, you have to get into the field. You have also to be a mom, you have also to tend to the business. So it's a lot to handle. That's why you need a support system. And it was a 12 weeks strenuous exercise, but at least we have finalized, we have been awarded. We can now go out there and say that at least we have tested
the fruits of your labor.
Exactly.
Maybe talk to other entrepreneurs, especially women, who actually maybe they want to start business. Some have started and they are at the brink of giving up. What do you have to tell them?
You see,
Just look at
this is the 8th year, going to the 9th year in Ashacare Medical Solutions. So how many times do you think we fell and woke up? So don't give up. Resilience is key.
Thank you so much.
Thank you.
Hi.
Thank you.